Hello and welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I am excited to be here with Dr. Sam Lau. Welcome, Sam.
Thank you. Pleased to be here.
Now, Dr. Lau has a long and impressive resume, and I'll just share with you a little bit about his background in case you don't happen to know Dr. Lau already. With 35 years of private practice experience in periodontics and implant placement, he's also past president of the American Academy of Periodontology, professor emeritus, University of Florida, College of Dentistry, and so much more. I'd encourage you to visit Dental Speakers Bureau to learn a little bit more about the impact that I see that you have had in our industry, Sam. It's really, really wonderful. Thank you for that. And for the purpose of this interview, we thought we would chat a little bit about some of Sam's workshops. He has multiple hands-on, lecture like an interactive lecture course, but he also offers hands-on opportunities for the clinician to work with the hog jaws and like the real true hands-on. We hear hands-on a lot in the industry, but it doesn't always mean working on clinical skills. Now, as we dive into this, the two workshops that we're going to discuss are advanced ultrasonic instrumentation with air medicament delivery and periodontal management, and utilizing laser technology in a periodontal environment. And maybe before we talk specifically about what our participants will learn in those courses, could we just address the elephant in the room? We're recording this mid-2020 as we're coming out of a major change in our industry with regards to COVID, and as we're starting to meet again and in smaller numbers, and we anticipate within months or certainly within the next year we'll be back to where we can meet in larger groups. Even before COVID, Sam, it felt to me like I wasn't seeing a lot of this. I've been in the industry for 20 years, and I used to see it felt like a lot more hands-on courses. Could you speak to the relevancy of why is this important for the clinician to have this type of course? And then also if you could just lightly touch on, is there a way to make it easy for the meeting planner?
If we think about what are we trying to do with the workshop hands-on course to begin with, how does that differ from a lecture? My favorite courses, by the way, are the workshop courses. They're the most difficult to do, but I really get to interact with the participant instead of seeing an audience of 1,500 people. So they're always going to be relevant because that's the way we learn. I think if it was psychiatry, it would be different. but we're people with we still do hand stuff. Yeah. Whether it be, as you mentioned, the advanced ultrasonic course with the air medicament delivery. Now we do add manual instrumentation because there are some concerns about aerosol, but we go through that. Or whether it be the laser course. But I think what you're mentioning, where you're going down, is exactly we're pivoting. I was already thinking about this before, about pivoting, because what is really, especially with the millennial generation, I'll tell you what was going on. We don't want to travel. We didn't want to travel before this environment that we had. You spoke to that. We want convenience. Yeah, we do more Zoom now, but we were doing a Zoom a lot before that. Yeah. And so I began to ask myself, well, wait, what can I afford someone who wants to bring me on into their organization to present? Well, we could do the traditional face-to-face. Wait, why come we can't do some of the didactic on Zoom before we get there? Then we wouldn't be wasting our time with me standing up in front of a screen. So we could do a combo. And then I began to think, well, wait a minute, there are going to be challenges, but why couldn't we do, within limitations, a complete Zoom hands-on virtual?
Love it.
It would take work, but we could do it. And so I already had the first two down, but then I'm sort of forced to start doing the third one down, and now we have it. And again, as you mentioned, it is a technological challenge because we do bring in specific pig jaws. We do bring in specific models. We want it to be what? As user-friendly to the participant.
Yeah.
Because if you're listening as a meeting planner, and you know this, Vanessa, technical logistics will take you to your knees. I mean, you cannot have technical logistics with this. So what am I seeing? I am blessed. Next week, I'm doing my first face-to-face. It will have, by the way, a Zoom component before, and actually I'm giving each participant who goes 1 hour of my personal time afterwards.
Oh, wow. Wow, wow.
For
Okay.
that. And so, well, you know, I did that probably in a weak moment because it really sold the course out. So now I've got to do all of these one-to-one Zooms, but wait a minute, wouldn't that be smart?
Yeah.
To do that? And so, and then guess what? 2 weeks later, we thought a course may not go because people were traveling. That course is absolutely going to go. And I also did that one too, where I give you a free Zoom of my time. And I must tell you, Vanessa, I sort of stole that from you because I'm so sorry. I learned by osmosis. I noticed that you do those kinds of things with your coaching.
Yeah.
So why wouldn't I be able to do that? Yes, financially, it's probably not the most smartest ROI, but that's what we're doing.
Well, you know what, I thank you for sharing that. And Sam, you know, what I take from all of that is that you are flexible. And that for the event planner, as someone who plans I have my own meetings that I plan, you know, as well as working with speakers, I feel like, and I anticipate you have a pretty good view into the typical event planners world because you've spoken for so many years, but they are juggling a lot.
No, I was an event. As associate dean for University of Florida, I ran continuing education for 10 years.
Fabulous.
So I walk in event planner shoes.
So
I know about budgets. I know about having the right speakers. So I've been on both sides.
So there's so many balls that are being juggled. And so what I hear is that you're willing to talk with the event planner if they're interested in working with you on one of these courses. That what I hear from this is that you have solutions, you're offering your own virtual hands-on courses, you have a team and processes in place so you can help them know how to do this. It's a new world for all of us in many ways, and quite frankly, I think there's going to be so many opportunities that come out of the challenges that we've gone through as meetings that it's going to be even better. But you know, dive us a little deeper into just briefly the two different workshops. So we have the ultrasonic instrumentation as well as the laser technology. You know, if you could just tell us, you know, who's it for and like what problem does it solve and how does it do that, just briefly on each.
Well, there's no doubt that instrumentation, and I can go into the insurance issues, time issues. This course is not just about the actual instrumentation. This is a whole new way of looking at how a hygienist operates within a practice. I mean, I'll be very straightforward. We take a 35 to 40-minute chair time on a 1-hour appointment and make it into a very effective, scientifically based 20-minute chair time. And now more than ever, where we're spending more time with patients because of infection control. So this is not just about how to use ultrasonics. We talk about ergonomics. We care about the hygienist. We talk about the coding. But at the same time, we show how to manage that periodontal patient non-surgically, using technology and using it safely. Yeah. We talk about aerosol control, and that's why we talk about this whole thing with the aerosol of the with the air medicament. I am convinced that we should be not spending more. You can have an hour appointment, but you should not be physically with that patient more than 20 minutes. We also go into periodontal charting and consistency of periodontal charting. Now, if I flip in, my passion is lasers. I have known this all along. No one goes and has their lens correction done with a blade. They have LASIKs. We will be there. We will be there. So this course in lasers deals with how to get gingiva out of the way so that you can do a crown prep. It has to do with laser bacterial reduction for the hygienist. It shows if you already have a laser, it shows you how to use that laser. If you don't have a laser, it shows you how to choose the laser, but it gives you that opportunity to do what? Test drive lasers. The course is not commercially driven. It's not for a particular brand, but it allows the clinician to do hands-on with having a laser or not having a laser and leaving there with 5 definite procedures that you can do.
That's awesome. They both sound really timely based on topic, but as far as what we're dealing with in dentistry right now and our patients. But I'm wondering if someone wanted to partner this hands-on, either of these hands-on workshops with another course, do you have like a lecture element that you would do and then maybe do the hands-on workshop separately? You could guide them that way.
There's no doubt that especially the advanced, and I probably shouldn't say advanced ultrasonic, it's advanced instrumentation is really what I should be saying. But that course works exceptionally well, where in the morning we do the innovative team building perio course called Innovative Periodontics for the general practice. And then from that, you'll see a segment of those hygienists and sometimes dentists that will want to move into the hands-on course. So those two pair up exceptionally well. And we've done that countless number of times. But also in the innovative course, we talk about lasers in that course. And so that parallels very well into the course. For me, being an event planner, whether it be face-to-face or what have you, I don't expect the event planner to bring in equipment. I do that. I have communication with all of the vendors. The vendors bring the equipment in. The vendors set it up. The vendors tear it down. And so, but also, by the way, although I said we don't try to do as much commercial, let's just face it. A company like Hugh Freedy or Dentsply is not going to come in there and bring all this stuff unless they get to be able to say hi during the course. But event planners, guess what you want? You want, I know you, this is not 30 years ago, you want sponsorships. You want it to be objective. And so I bring to the table, 10 plus sponsors that you have the choice of being able to utilize if you desire.
That's awesome. The bottom line with sponsorship is it needs to be a win-win-win for everyone. And I have no doubt that you have great solutions to offer there. Well, before we wrap this up, Sam, is there anything about your workshops that we haven't chatted about that would be important for the planner to know?
Just re-emphasizing versatility. Being a past event planner, I know the trials and tribulations, but I know that workshops, I think you said it right. Yes, you know what we're going to find? This created more opportunities for us.
Yeah.
But what we do is we create user-friendly to make your objective is to have a successful event to where other people are going to come in the future. I mean, that's the way this is. And so I pivot. I'm listening. I am a dyed-in-the-wool educator. We can make this happen.
Wonderful. Well, there you have it. Thank you so much, Sam, for being with us and sharing information today about your workshops. And for the event planner who would like to find out more about any of Dr. Lau's programs, you can visit dentalspeakersbureau.com, or you can go directly to Dr. Lau's website. That is drsamlau.com, drsamlow.com. And thanks for tuning in to this episode of The Buzz. And thanks again, Sam.
Thank you. Appreciate it.
Until next time, be well.